Well, this is something they should have found out before they decided to have this rollout. They should have done this beforehand. NIH orders 1.67 million study on how WOVID impacts menstrual cycle. The National Institute of Health has announced a $1.67 million study to investigate reports that suggested that the WOVID vaccine may come with an unexpected impact on reproductive health. It's been a little over 6 months since the 3 COVID-19 jabs in the U.S., Pfizer, Moderna, and Johnson & Johnson, became widely available to all adults. But even in the early days of vaccine rollout, some women were noticing irregular periods following their shots, as reported first by the Lilly in April. Shauna Clausen, 48, spoke to the Washington Post women's news site at the time and again this week about her experience after getting the jab, revealing that her period arrived earlier and heavier than what she considers normal. She was one of the many who gathered on social media to share what they were seeing. Is it not being discussed, or is it even being looked at or researched because it's a woman's issue? Clausen speculated to the Lilly last spring. It would appear that the National Institute of Health heard Clausen and other reports as they announced on August 30th that they intended to embark on just such research, aiming to incorporate up to 500,000 participants, including teens and transformers and non-binary people. Researchers at Boston University, Harvard Medical School, Johns Hopkins University, Michigan State University, and Oregon Health and Science University have been enlisted to embark on the study, commissioned by the National Institute of Health, National Institute of Child Health and Human Development, and the Office of Research on Women's Health. The approximately year-long study will follow initially unvaccinated participants to observe changes that occur following each dose. More specifically, some groups will exclude participants on birth control or gender-affirming hormones, which may have their own impact on periods. Our goal is to provide menstruating people with information, women with information, mainly as to what to expect, because I think that this was the biggest issue. Nobody expected it to affect the menstrual system because the information wasn't being collected in the early vaccine studies. Wow. Said by the NICHD Director Diana Bianchi in a statement to the Lilly, reportedly crediting their early coverage for helping to make the NIH aware. The NIH suggests that changes to the menstrual cycle could arise out of several of life's circumstances during a pandemic, the stress of lifestyle changes, or possibly contending with illness. That's cap. That's all I'm going to say. Moreover, the immune and reproductive systems are intrinsically linked, and the notion that the immune boosting vaccine may disrupt the typical menstrual cycle is plausible, as demonstrated by previous studies concerning the vaccine uptake. It's also worth noting the vaccine does not cause infertility, and the Center of Disease Control and Prevention recommends the shot even for pregnant women. That's cap too. As changes to the menstrual cycle are really not a life and death issue, explained Bianchi, the Food and Drug Administration, fast-tracking their work, prioritize only the most critical risks associated with the WOVID vaccine. The NIH, too, pulled together the initiative at breakneck speed. Funding for such study would typically take years to see approval. We were worried this contributing to the vaccine hesitancy in reproductive age women, said Bianchi. So, look, this this right here is just, this was kind of expected because they didn't do this properly. I'm just going to say it. They didn't do this properly. Okay. And, people are going to suffer because of this. That's all I'm going to say. People are going to suffer because of this, because of the incompetence of what's going on. And it's going to get worse. It is going to get worse. But I'll tell you this, most of this article is cap. I'm going to just say that. What they're trying to say, what they're trying to ease people's worries, they're not. They're capping. They're capping hard. That's all I got to say. Okay. And I hope, I really hope that people who, people who got the jab are doing okay. But this is going to be, things are not going to get better. That's all I could say. All right. Tell me what you think in the comments. Like, share, comment, subscribe. Later.